Multiple myeloma is the second most common type of blood cancer, with nearly 230,000 people living with the disease globally. It is a cancer of the plasma cells, which are found in the bone marrow, the spongy tissue located in the center of many bones where blood cells are produced. When plasma cells become cancerous, they start to multiply within the bone marrow and crowd out the normal blood cells. In very early stages of the disease, a patient with multiple myeloma may not show any signs and symptoms. Once signs and symptoms do appear, they may include frequent infections, bone pain and fractures, reduced kidney function, anemia, and/or fatigue. Multiple myeloma is hard to find early. Many patients don't have any symptoms until their disease has reached an advanced stage. Diagnosis can be shocking and devastating, leaving those affected and their family and friends feeling overwhelmed and distressed. Although multiple myeloma cannot be cured, there are a number of treatment options available, and advances are being made in the management of the disease. The goals of treatment are to control tumor growth and provide symptomatic relief. A patient is considered in remission when myeloma cells cannot be detected in the body and there are no symptoms. However, one of the key challenges of the disease is that due to its aggressive and progressive nature, the disease is likely to advance and symptoms will return, which is known as a relapse. For some, the disease will stop responding to the treatment the patient is currently receiving, and this is referred to as refractory multiple myeloma. Uncertainty as to what the future holds and when a relapse might occur can lead to feelings of worry and anxiety. Patients may become concerned about a loss of independence as their disease progresses and they become more dependent on loved ones and caregivers. They might also have concerns about the financial implications of the disease if they're unable to work or have issues relating to health insurance or reimbursement of treatment. Each time the multiple myeloma returns, treatment is adjusted by the physician. This can be done a number of times to help manage the reoccurrence of the disease, though the amount of time between each period of remission gets shorter and shorter as the disease progresses. In addition to treatment, addressing the emotional stress that accompanies the disease is essential. Support may come from healthcare professionals, patient support programs, advocacy groups, others with multiple myeloma, or caregivers. Managing multiple myeloma is complex. Therefore, it is important for patients and caregivers to understand the management strategies and treatment options available. With ongoing research and an evolving treatment landscape, there is growing hope for future advances in patient care. The goal in multiple myeloma is to transform this fatal disease into one that is chronic and manageable.